The Indiana SANE Training Project is a collaborative effort led by Southwest Indiana AHEC and the University of Southern Indiana to ensure that victims or survivors of sexual assault or child sexual abuse receive competent, confident care in their community, regardless of where that is.
We work to help ensure that individuals who have been impacted by crime or trauma have access to medical forensic care. This is often through training medical personnel, such as nurses or advanced practice registered nurses, to become what's called a sexual assault nurse examiner. We help provide their didactic training, and we offer them clinical training and support. And then once they are operating independently and practicing within their facility, we also offer continuing education.
There is an ongoing amount of support that comes from the SANE program and the instructors and the nurses that are involved with that. They are always available to us if we have questions. If we ever encounter a situation that we're unfamiliar with or we aren't readily prepared to handle, they're just a phone call away, a text away.
So the project has been recognized throughout the state of Indiana, nationally and internationally, for the impact that they have had on implementing and developing education for medical forensic nurses. They partner and collaborate with experienced forensic nurses and multidisciplinary leaders in the field to ensure that they meet the scope and standards of practice with each clinician.
One of the things that we do the most is making sure that they can practice independently back at home. Not every facility is going to operate like a level 1 trauma center. So we have to work with communities who are smaller, more rural, sometimes even communities that don't have hospitals. How are they going to get this care to the patients that need it? So we have adapted our model a little bit to ensure that we are reaching out to healthcare providers that are working within a clinic setting. We are working with schools to ensure that nurses within the school, perhaps they're not trained as SANEs, but they understand what to do when a child discloses sexual abuse and how to get them to the appropriate place.
Some of these patients that I see are an hour, hour and a half, 2 hours outside of city limits. So having a greater number of SANE nurses out there greatly impacts their ability to receive care.
In addition, a report came out in 2019 that showed that Indiana had a high incidence of child abuse reports, and we wanted to make sure that those kids were getting care in the communities where they live. So we've expanded our focus to encourage everyone to not just provide exams for adult and adolescents, but also pediatrics. And so we've created new trainings, we've provided more resources, and we've encouraged the nurses in those communities to, in effect, provide full service care for those people.
So through collaborative efforts with this SANE training project and my role at the Indiana Department of Health, we've been able to locate and target areas of the state to develop these programs that were in dire need where they didn't exist before. And we were able to build these programs designed for the communities where they were located to fit essentially their needs as well as the resources that they had available. This allows greater access and reduces limitations for the survivor to have that specialized care.
We operate from a statewide purview, so we have partnerships at statewide agencies. We have partners with local law enforcement, county prosecutors, and advocacy organizations. We really are bringing a multidisciplinary approach to this level of care.
So the ability to have nurses that are specifically trained in sexual assault examination is so helpful for the victims, for the people that are prosecuting these cases, that it gives a voice, an additional amount of information in court to be able to provide to a jury when you are in trial.
We have done a lot of amazing work already related to coverage in counties within Indiana. We have increased the number of counties who offer pediatric exams by 64%. We've also increased by 36% the number of counties who do adult-adolescent exams. That positive impact excites me. I'm excited by the people who want to be involved in the project. We have interest not only all across Indiana, but across the country. And the people that are involved in the project, who teach, are all very dedicated and committed, and those are the people that we need to continue supporting through this project so that we can have a real impact on the state.